Today's lecture is on cruciate anastomosis and trochanteric anastomosis. These two anastomoses are related with the upper end of the femur near the hip joint. And based on the high mobility of the hip joint, these anastomoses provide collateral pathways to maintain the blood supply to the hip joint. So let's start with the cruciate anastomosis. What does cruciate mean? Cruciate means crisscross, like a cross. So anastomosis is the union between two vessels or more than two vessels. So cruciate anastomosis is basically a cross-shaped anastomosis, which is located over the lesser trochanter, middle of the lesser trochanter of the femur. So in the diagram on the right side of the slide, you can see this is the greater trochanter, and here we have the lesser trochanter, and this blue circle is highlighting the site of anastomosis at this level. Formation. How is this anastomosis formed? What are the arteries? What are their branches that participate to form this anastomosis? The main arteries that participate with the help of their branches to form this anastomosis at the middle of the lesser trochanter of femur are inferior gluteal artery, medial circumflex femoral arteries, lateral circumflex femoral artery, and first perforating artery. Their branches basically participate to form the cruciate anastomosis. So a descending branch from the inferior gluteal artery, another ascending branch from the perforating artery, and medial lateral circumflex femoral arteries, they give out transverse branches. So descending branch, as the name is indicating, will descend from the superiorly located inferior gluteal arteries. This artery is superiorly located among these arteries. Then in between the inferior gluteal and first perforating artery, we have circumflex femoral arteries. The name circumflex means surrounding. Surrounding what? The upper end of the femur. So these two arteries will give off transverse branches. The direction of their branches will be transverse. Whereas perforating artery, first perforating artery, since it is given off by the profunda femoris in the thigh, so naturally it will give off an ascending branch, which will run superiorly to participate in this anastomosis. So in this form, in this way, this anastomosis will be formed, and the shape of the anastomosis will be like a cross. What is the significance of this anastomosis? This anastomosis provides connection between the internal iliac artery and femoral arteries through their branches. Next anastomosis is trochanteric anastomosis. Trochanteric anastomosis, the name is self-explanatory. It has nothing to do with lesser trochanter, but rather it is located near the trochanteric fossa, which was located on the medial aspect of the greater trochanter of the femur. So this anastomosis is formed near the trochanteric fossa of the femur. What are the arteries and their branches that participate to form this anastomosis? We have superior gluteal artery through its descending branch. Then we have inferior gluteal artery itself. Then medial femoral artery through its ascending branch, and lateral femoral artery again through its ascending branch. So descending and ascending branches as well as inferior gluteal artery, they unite to form the trochanteric anastomosis. So descending branch from the superior gluteal artery joins the ascending branches from the medial and lateral femoral circumflex arteries, which is later joined by the inferior gluteal artery to complete the trochanteric anastomosis. What is the significance of trochanteric anastomosis? It provides the main blood supply to the head of the femur. The branches of these this trochanteric anastomosis, they basically pass along the retinacular fibers of the hip joint capsule. What are retinacular fibers of the capsule of hip joint? We will study these fibers, inshallah ta'ala, in the upcoming lecture on hip joint. So this was a small lecture on the location, formation, and clinical significance of trochanteric as well as cruciate anastomosis. So here is a question which is of great importance because this question is commonly asked in the MCQs and in the Viva questions of the university examinations. So here we have the question, name the origin of the following arteries. Superior gluteal artery, inferior gluteal artery, medial and lateral circumflex femoral arteries, and first perforating arteries. You have to write down the names of the arteries that give off these arteries as their branches. So you can leave your answers in the comment section.